Hello everyone, welcome to Prelims High Yielding Series for Prelims 2020, and the topic for this video is Typhoid conjugate vaccine. So in October last year, Pakistan became the first country in the world to introduce this World Health Organization's recommended Typhoid conjugate vaccine. So they named it the Type Bar TCV in its national immunization program against the extensively drug-resistant typhoid outbreak. So this Type Bar TCV was actually manufactured by an Indian company called Bharat Biotech, which is also working on the COVID vaccine right now. So what is this conjugate vaccine? What is the organization that has helped Pakistan to come up with this vaccine? Let us have a look in this topic. So Type Bar TCV is being administered in Pakistan with an organization by the name Global Alliance for Vaccine Initiative, or simply called GAVI. So what is this GAVI? It is a global health partnership. Now this is the point where one might get confused. Is it a UN body? No, it is not a UN body. It is just a partnership of public as well as private also. Not just governments but also the private sector. Most of the times, remember that when we are dealing with problems such as healthcare, education, it is always better to have as many hands as possible, or we can take all the kinds of help that is available at our disposal. So private sector cannot be excluded from R&D activities with respect to any sort of vaccine. Therefore, definitely, if there is a question statement which says that it is only a public sector entity bodies, or where it says that it is only national governments, then that statement is false. So you have various global organizations like the Melinda Gates Foundation, the World Health Organization, World Bank, UNICEF. So all these arranges vaccines to poor countries like Pakistan and other countries, or the least developed countries. So let us try to understand what a conjugate vaccine actually means. Like we have seen in the case of COVID, the world is running around to create a vaccine as soon as possible. We are waiting with a bated breath to have a vaccine so that the life comes back to normal. So what exactly are these vaccines? Vaccines are used to prevent diseases by invoking an immune response to an antigen. Note this point very carefully. Antigen. So what is an antigen? So any part of a bacteria or a virus that the immune system recognizes. Again, note this point. The immune system should recognize. If the immune system does not recognize, it is a bigger danger. So any foreign particle, in the case of COVID or the coronavirus, which has certain spikes, so these spikes get attached to our body cells, for example RBCs or any sort of a tissue, and from there it replicates. So this process is because this is a virus strand and has RNA in it, so it cannot actually replicate without attaching itself to a host cell. So this is the important takeaway. Vaccines are very difficult for viruses because they change so quickly depending upon the host cell, unlike bacteria which have a stable cell structure and DNA material. So in this context, when we are talking about the conjugate vaccine, we have to understand what a attenuated or a dead version means. So how can we actually recognize, how can the system actually recognize this foreign particle? So this dead version of the bacteria or virus is introduced into the body, and this will become the antigen later in the life because our body recognizes that. Many vaccines contain a single antigen that the body will recognize. However, sometimes body fails to recognize and it will not elicit a strong response for future attacks. Now this is a possibility even in the vaccines that we are creating for COVID. If we are not generating a strong immune response, then that vaccine is bound to fail. So conjugate vaccines combine the weak antigen and a strong antigen as a carrier so that the immune system has a stronger response to the weak antigen. That is the significance of this attenuated or the dead version of the vaccine. Please read this question very carefully. Vaccines are used to prevent diseases by invoking an immune response to an antibody. Now this is the important point. Like I've told you, this is not antibody, this is antigen. What is the difference between antigen and an antibody? Antigen is a foreign fragment of a virus or a particle that is created by virus or a bacteria. Now in response to this, the kind of proteins generated by our body to fight these antigens is called antibody. Now nowadays we're talking about plasma. So basically, to fight the coronavirus outbreak, we are using the plasma of recovered patients, because whenever a patient recovers, he develops immunity through the presence of these antibodies. In patients who are not able to fight the COVID virus, they will be injected this plasma. Basically, they are trying to inject antibodies into the patient so that he gets some more strength. It is like an external help to fight the virus. So the first statement is false. Pakistan became the first country in the world to introduce TCV. That is right. So 2 only is the answer. This question is in the context of the previous video. This question is a sort of a revision. Please try to understand what this RT lamp test is in the previous video. Try to come back and answer this question. That's it for this video. Thanks for watching. Please do not forget to post your answers for this question in the comment section below.